Hello and welcome to this week's episode of Just Jing TV. So this week we're going to talk about a structure that's very important to massage therapists, but we're a little bit afraid of. What can it be? It's the spine. And as a massage therapist, we are often taught,
you can't touch this.
Can't touch this.
I know, it was better rehearsal. No, it wasn't. That was actually the best time we did it. Okay.
But you can touch it.
But you can touch it.
You really can touch it. Look, there's Meg touching it, and you can do things on a real person as well. So let's orientate ourselves to the anatomy of the spine.
Okay.
Go, Meg.
So the spine, these are the vertebrae, and they're broken up into three major sections. So you have the lumbar vertebrae, the thoracic vertebrae, and the cervical spine, okay? And what you need to think about with each one individually is this little thing that sticks out. So this is called the spinous processes. And those you can palpate pretty well right through the skin. So when somebody lies down, I mean, not all of them, but quite a lot of them you can palpate straight through.
With a skinny person, you can just see them. Often on little kids, you just see the spinous processes.
And then the ones that stick out to the side are the transverse processes. So at Jing, we often call them the Frankenstein bolts. And they just come out through the spine. And then the yellow bits here, obviously are supposed to represent the nerves.
Yeah. And then in between, so if you notice as well, all the lumbar vertebrae are quite big because they carry a lot of support, and then the cervical vertebrae at the top are a lot smaller, and the thoracic vertebrae are somewhere in between the two. And in these structures in between, these are actually the discs, the disc that can often get herniated. I think that one is supposed to represent a herniated disc. It's more like a little tongue.
Yeah, so this would be the nucleus pulposus within the disc, that where something had happened to the disc, which made it able to, the slip to be able to come out through the side.
Yeah.
So
and
actually
the disc arise if that presses on a nerve.
A nerve, yeah. So the disc itself doesn't ever shift. It doesn't slip. It's actually the jam inside the donut, which I think some of you have seen quite a lot of. We did that on one episode, or we did it on the low
back course, didn't we?
Where we squashed a donut. Yeah. So, this is kind of the idea, and then that pressure happens in the nerve.
Yeah.
Okay.
And then other important things, this is the sacrum. So I think Tom Myers says this sacrum's a bit like an arrow that comes down and splits the pelvis into,
I often think of it as almost the same structure. Oh, Rachel, hold the top of this.
Oh, sorry.
So it's like the whole hand. So usually I look at somebody's sacrum to be about the size of their hand, and it's nice that V. And then this, of course, is the coccyx. And these are called the foramen, which actually, for those of you who hung around Jing a while, will know that those also hold quite important acupressure points.
Yeah, so they're holes basically. So when massage therapists are taught not to touch the spine, what we're really being taught is it's not within our scope of practice to do what's known as high velocity thrust manipulation. However, there are plenty of other things. There's plenty of soft tissue structures around the spine that we can treat and work effectively. So some of the muscles in the spine there's lots of little muscles in between the vertebrae called the multifidi and the rotatories, which funnily enough actually rotate the spine, do what it says on the skin, on the tin. And there's a technique we use a lot of Jing, which we really like, where we sink our fingers into the laminar groove here and just work up and down, and you can really get some of the good soft tissue structures there and trigger points.
And the course that we teach at Jing, which is called Working with the Spine, is about getting people to feel happy enough to kind of understand where the spine is, to understand how you treat all those little muscles that attach the spine, and actually you want to be able to help the spine be malleable and move and in its appropriate structure, because the spine itself is not. What I think is really interesting is the spine is not holding us up, okay?
No.
The spine itself is actually floating in the fascial sheaths and the muscles.
It's a tensegrity
structure. It's a tensegrity structure. And so, it needs to have space in order to function. So the manipulation, the high velocity manipulation that a chiropractor or an osteopath might do, puts the spine back into form. But if the muscles and the soft tissue aren't opened up and giving space, then the spine will just get pulled back into whatever postural I don't want to say deform, but imbalance that kind of occurs.
Yeah, and talking about structural imbalance, so just a quick thing about that. There are a few deviations to the spine that can happen. One is called a scoliosis. You might have had people coming in and saying got scoliosis. That's when there's a kind of sideways bend of the spine. Often if something is bent sideways, then it has to bend back again.
So it's like an S curve.
At another point. A kyphosis is when the top part of the spine usually sort of bends into a C shape. So you might see that somebody with very hunched shoulders, narrowed at the front. And then a lordosis, hyper-exaggerated lordosis, is when this curve becomes exaggerated. And I think the most important, I think the most important thing to know about all of those three structural conditions is there's not necessarily any correlation between those, even in a severe condition, and any pain that the client's in. So don't get distracted by that. I think in your clinics and in your soft tissue work that you do.
I'm not 100% sure I understand why there's so much fear about it, because it's such a strong structure that actually, in order for you to cause damage to the spine, you'd have to have intent, right? You'd have to have quick, sharp blows, I don't know, with your elbows and the spinous processes. It would be very difficult to damage the structure. And especially the way that we see most massage therapists working. You really want to just think about opening and creating space.
Yeah. So don't be afraid. It's a beautiful thing. So don't be afraid of the spine. You can touch it, and there's lots of stuff that you can do. So come on a course at Jing, you come on a low back course. We've also got a specialised working with the spine course that we teach 2 days, 1 day with a physio who helps you understand some rehab exercises and some great mobilisations for the spine, and also some great soft tissue work that we do on the other day. And yeah, biggest message is don't be afraid.
Yeah, it's fantastic structure. Get involved in the conversation on Twitter and Facebook, or come to Jing in Brighton. We'd love to see you.